teleconference involves the surgical trainees of the Tondo Medical Center and the surgical trainees.
And to the farthest left is Dr. Tondo, also a second-year resident. And serving as our scribe is Dr. Zanaka, a third-year resident. And to my right is Dr. Tommy Cristobal, a fourth-year resident.
Thank you, Maya. As I said earlier, the topic for our teleconference is on breast. The learning objective is for us to acquire the cognitive skills in managing patients with a breast problem. To the audience, actually this teleconference is in preparation for our establishing breast clinics in Zamboanga City Medical Center and in Tondo Medical Center. The format of the conference is as follows. I will ask questions for the surgical trainees to answer and to use them as starting points for interaction. Through the questions, I will try to bring out all the essential things in the management of a patient with a breast problem. Through the questions too, I will try to see if the surgical trainees are ready to run a breast clinic in their respective hospitals. Before we proceed to the conference proper, I'd like to ask a trainee from both medical centers to serve as a scribe. The scribe will go to the board and write down the data that I will present and the answers that the trainees will be giving. Dr. Myelin, do you have a scribe there?
Yes, Doctor, we have assigned John to act our scribe, but he also wants to participate.
Now, on our side, Tondo, who will serve as a scribe? Arnold? You can also participate, Arnold. So let's start with the teleconference proper. Enumerate at least 10 breast disorders that I'm about to start answering this question. Can you give another one, Rex?
Breast carcinoma, macrocyst, galactocele, mastitis or breast abscess, could have benign cystosarcoma phylloides, could have intraductal papilloma, Paget's disease, we have mammomegaly, and gynecomastia.
Is there anything you want to add from Zamboanga side, Dr. It's called Dr. Boa.
Out of the ones mentioned on tuberculosis of the breast.
Any more addition from the side, Richard?
I think it's already completed.
Okay. The next thing that I will do is to give you some data which consists of signs and symptoms. And what I want you to do will be to give the clinical diagnosis. Later on, we will start discussing the indications for paraclinical diagnosis as well as the plan for treatment. So the first case will be given a 25-year-old female, married, presenting with a left breast mass, 2 centimeters in size. It's not hard, non-tender, very movable, with very well-defined border, and no axillary node. I repeat, 25-year-old female, married, left breast mass, 2 centimeters in size, not hard, non-tender, very movable, very well-defined border with no axillary node. What is your clinical diagnosis? Dr. Chong?
I will consider in this patient fibroadenoma.
Can you assess the certainty of your diagnosis as to quite certain or not certain?
I'm quite certain.
Do you need a paraclinical diagnostic procedure for this particular patient?
It's not in the doctor.
Now, let's ask from the Tondo side. Dr. June Burgos, do you agree with the clinical diagnosis?
Yes, doctor, I agree with the Zamboanga side.
Do you want to do a paraclinical diagnostic procedure?
No more, doctor, because I'm quite certain of the diagnosis.
Okay, let's go back to Dr. Chong. Dr. Chong, what will be the next step in the management after your diagnosis?
I would advise this patient that her condition is surgical intervention, and that would be excision of the mouth.
Can you give us a little detail on how you're going to proceed with the operation, Dr. Chong?
I would have subject the patient just under local anesthesia. Use 2% Xylocaine, and I would have to make an incision that is curvilinear, and after removing the bismuth or this lesion, I would have to make sure there are no bleeders, and then close the skin. Then this lesion or this mass was removed, I would send it to the lab for rest.
Okay, what is the common complication associated with excision of a benign breast tumor? Dr. Allen?
Well, the complication of excision of the benign tumor, the complication of the benign breast, excision of the breast tumor is one is hematoma, and
Can you suggest ways of how to prevent these complications, Dr. Allen?
well, to prevent this complication, you have to take all the bleeders and do a layer, close the subcutaneous layer by layer.
Any reactions from Zamboanga side? Dr. Taluba?
The closure of the in order to prevent hematoma formation or leukocytoma is just the same as we mentioned that closure layer by layer. But however, we can also do, with the cavity form after the excision of the mass, we can close the cavity with a chronic suture just to prevent athletic space where this hematoma or seroma can accumulate.
Okay, we're practically through with the first case. Do you have any questions from the side? Yes, Dr. Burgos.
Sir, I would just like to comment on the biopsy of the fibroadenoma. Since your intraoperative findings is a fibroadenoma, and you're quite sure with your diagnosis, I think you may not send the specimen for biopsy.
Okay, would you like to react to that, Dr. Chong?
Since we remove the lesion from this patient, for documentation, we have to make sure in terms of the patient and for our interest, we have to send it for biopsy. And there's nothing, we don't have anything to do on that.
Any other comment? Zamboanga side, Tondo side? Yes, Dr. Angeles from Tondo.
I'd like to comment further on the biopsy. There's nothing wrong in giving the patient this for the histopath or for biopsy or the specimen for biopsy. What we are usually is that if